Hello everyone, it's me Dr. Ayaz Ahmed. I am working as an aesthetic dermatologist. Today I will discuss another important topic for you. The name of topic is Reed syndrome. Hopefully you will learn and subscribe my YouTube channel. Definition and overview. Reed syndrome, also known as hereditary leiomyomatosis and renal cell carcinoma, is a rare genetic disorder. It is characterized by development of multiple cutaneous leiomyomas, or in other words, you can say benign smooth muscle tumor in skin, and uterine leiomyomas, which is also known as the fibroid in women. This syndrome is associated with an increased risk of renal cell carcinoma, particularly papillary type. Genetic basis of Reed syndrome. There are two main bases. Number first is the fumarate hydratase gene. The condition is caused by mutation in fumarate hydratase gene. This gene plays a critical role in cellular energy metabolism through Krebs cycle. Another important genetic basis is the autosomal dominant inheritance. Reed syndrome is inherited as autosomal dominant pattern, meaning that a mutation in one of the two copies of gene is sufficient to cause this condition. Each child of an affected parent has 50% chance of inheriting the mutated gene. Now clinical features. The clinical features are of two types. Number first is the cutaneous clinical features or dermatological features. These include cutaneous leiomyomas. There are benign tumor derived from smooth muscle cells. They appear as a small firm nodule or papule, often on the trunk, arm and leg. The lesion can be painful, especially to cold or touch, and may cause discomfort. Appearance of lesions are typically 1 to 5 cm in diameter and can be solitary or multiple. They may be flesh colored or slightly darker than surrounding skin. Symptoms include pain or discomfortness upon palpation and cold exposure, and emotional stress is common. Systemic clinical features are uterine leiomyomas, which is also known as the fibroid. Women with Rett syndrome often develop uterine fibroid, which can lead to symptoms such as heavy menstrual bleeding, pelvic pain, and infertility issues. Another important systemic clinical features is the renal cell carcinoma. Individuals with this syndrome are at risk of having developed papillary renal cell carcinoma. It is a kidney cancer. Early detection is crucial for effective management. This image describes the appearance of small papule or nodule on the face. Always note that these small nodule or papule are painful, especially when they are touched or when they are exposed to cold. These nodules can be noted in the face, shoulder, upper arm and lower leg area. In picture A you can see the involvement of face, and in picture B you can see the involvement of shoulder area. These are small smooth papular nodule with flesh colored appearance. Always note that these nodules may look darker than the surrounding skin. This is the involvement of forearm by these small papular nodule like structure. You can see the appearance is darker as compared to normal skin or normal surrounding skin. This is the involvement of neck by these papular nodule like structure. These structure can also be noted on the back area as shown in C picture. Diagnosis. Histopathological examination. Number first and number second is the by genetic testing. The histopathological examination is usually done by biopsy of skin or by uterine lesion to confirm the presence of leiomyomas. Genetic testing for mutation in the FH gene can confirm the diagnosis and help identify family members who may be at risk of having Rett syndrome. Now, management. The management for cutaneous leiomyomas. The options include number first is the surgical excision, often used for isolated symptomatic lesion but can lead to scarring. Second option is the cryotherapy, effective for reducing pain and size of lesion, especially for single or small lesion. Third option is the CO2 laser ablation, reduce pain and size of lesion, often with fractional CO2 laser being effective for disseminated lesion. Fourth treatment option is the botulinum toxin injection, may help with the pain control by inhibiting neuropeptidase release. Fifth is the topical analgesic and patches. 5% lidocaine patch provide non-invasive pain relief. The management option for systemic involvement include number first is the uterine leiomyomas. Uterine leiomyomas can be managed by surgical intervention, which include myomectomy or hysterectomy, which may be necessary for symptomatic fibroid. Another treatment option is the hormonal therapy, which include gonadotropin releasing hormone and anti-hormone medication can manage the symptom. Renal cell carcinoma can be managed by surgical removal by nephrectomy, which may be required for kidney tumor. For pain management, medication like calcium channel blocker, example nifedipine, alpha blocker, and anti-seizure medication can help manage the pain. Thank you very much. Stay connected and subscribe my YouTube channel.